But based on all of that and having met and worked with you know, the group that we have in here on campus, and you'll be hearing from Dr. Cheryl Hug English in a moment because she is indeed the subject matter expert. We made some decisions, and these decisions were not easy, but we did feel that they were in the best interests of our campus community. The first thing that we decided to do was close the Wiegand Fitness Center, and we understand that that is a place that students like to go, particularly in this environment. But the information that I have, just a moment, that we have shared, sorry, I had something come on my computer, is that since the beginning of school that we've had over 60 positive cases that have visited the Wiegand Fitness Center of students, and there have been 6 employees of the Wiegand Center that have tested positive. And of those cases, about half of them were unknowingly visited the fitness center during their period of infectivity. So that was, again, a great concern for us. And given that information, and given that that we were aware of these statistics, we made the difficult decision to close the Wiegand Fitness Center.
Late for listening to this. How are you?
If we could please, sorry, President Sandoval, if we can make sure everybody's on mute, please. Thank you.
We also, in accordance with the Washoe County Health Department's rule of maximum gathering size of 250 people, made the decision for the first football game, which is versus the University of Wyoming on October 24th, not to have fans, and that game will be limited to the players and 250 individuals, which are family of the fans, as well as cheerleaders and band members. And finally, and I would really encourage all of you, and Dr. Hug English is going to walk you through this. We have put a new dashboard on the website that will give you on a daily basis the updates with regard to the statistics on campus. And I think that you'll see that it'll be very useful in terms of sharing information. But again, this is a matter that we obviously take very seriously. You know, we want to do whatever we can to protect our students, protect our faculty, protect our staff. You know, we're calling it Protect the Pack on campus. I've also encouraged the campus community to use the Nevada COVID Trace app, which I have on my phone myself, which I think will be extremely helpful. But with that, those are my introductory remarks. I wanted to turn it over to Dr. Hug English to walk you through some more of the specifics of the figures and what's going on campus right now, and also walk you through the dashboard as well. So I'll turn it over to Dr. Hug English. Thank you very much.
Thank you, President Sandoval. And it's really nice to be with all of you this morning. I am Cheryl Hug English. I'm the director of the Student Health Center. And as many of you know, the Student Health Center has remained open during the entire time since March and COVID-19 first entered our community. And we currently are providing a wide variety of healthcare services, both in person and by telemedicine for both physical and mental health care needs. In addition, we're continuing to do our daily COVID-19 testing for students, faculty, and staff every day by appointment only. And this occurs out in the front of our facility. I will share with you that since the semester started, we have tested 2,176 students and 102 faculty or staff. We work very closely with Washoe County Health District in providing notification and initial contact tracing of our positive cases. And I am incredibly grateful for that partnership and the incredible work that Washoe County Health District is doing. As President Sandoval mentioned, our campus really continues to work incredibly hard promoting policies to help mitigate this virus. And I think that there has been very good compliance with a lot of those protocols that President Sandoval mentioned. In addition, our campus density is quite different than any other semester. We only have 4% of our classes fully in person, with about 23% having some in-person component. But we continue to look for ways that we can further decrease the positive case numbers that we're seeing in our students. And some of the steps President Sandoval have discussed is an example of that. These are not easy decisions to make. The university has been transparent in reporting the number of our positive cases. However, in order to make that data more accessible and comprehensible, we have started this new COVID-19 dashboard. And in just a moment, I'm going to ask Scott to put it up live for you, but I want to introduce it first. It's located on the homepage of UNR under their coronavirus updates. And if you simply go to the COVID-19 dashboard, it will pull right up. And the data includes COVID-19 testing and results, not only from the Student Health Center, but all testing sites throughout the community. And it also will give updated information about how many students are currently isolating or quarantining in our residence halls. So we're hopeful that this dashboard and new way of presenting our data will make it easier to visualize and interpret. So Scott, if you wouldn't mind kind of putting up the dashboard, and I can maybe take a moment to walk people through it.
Okay, are you guys seeing it on your end?
So if we could go to the top of it, if that's possible. Perfect. So when you see it, it will say protect the pack, and the dashboard begins with the cumulative reported COVID-19 cases. So the first that you will see is for the latest week, which in this case ended on October 2nd, Friday, October 2nd. And I do want to just give a caveat to the fact that the data may shift or change a little bit, because we do get reports from a variety of sites that often come in later. So those numbers may change a bit if you're looking at it from week to week. But in the week of 9/26 to October 2nd, cumulative, we saw 107 student positive results for faculty and staff, for a total positive number of 111. And again, these are from all testing sites. Working below, this is a cumulative report that goes all the way back to March when we first started collecting data. Currently, we have over all testing sites 85 student cases that are active. What that means is they are still during their period of infectivity. We have 496 that have recovered and a total of 581 student cases. Below that, you will see the faculty data. We have 4 active cases, 38 who have recovered, and 42 cumulative cases. And if you move a little bit further down, Scott, this now talks about our on-campus testing. These are tests that are done at the Student Health Center. And for the past week, as you can see, we've tested 173 students and had 11 positives this week, which was a big decrease for us for the rest of September. But again, overall in September, we've had concerning numbers, which is why we are taking the additional steps that we are. Moving down a bit further, you'll see the cumulative data. Again, we have 25 active cases that were tested at the Student Health Center, 259 that have recovered, and overall 284 student cases that were tested with us that had been positive. And again, faculty data, we have no active cases that were tested with us during this time. We have 7 that have recovered and a total of 7 cumulative cases, again, just that have tested at the Student Health Center. And moving to the bottom, you'll see the residence hall data. This reflects, again, the cases that are either in isolation and quarantine and just again, to talk about the differences in those terms. Isolation refers to those that have been actively diagnosed with COVID-19, and quarantine refers to those that we are separating because they have been in close contact with someone that had been diagnosed with COVID-19. So you can see that we have currently in isolation or quarantine 68 students. We have had a total, this goes back to the beginning of the semester, of 97 cases in our residence halls, and a total of 257 that have completed either quarantine or isolation. You can go down one little bit further. These are our current students who are actively isolating because they are currently positive. We have 27, and we have an additional 10 students who are isolating who are currently positive at home. And we have 31 students who have been close contacts and are currently in quarantine. So that's kind of a snapshot of the dashboard, and I will end there, and we're happy to take questions.
Yes, Dr. English?
Yes.
Oh, okay. Frank Mullen with the Reno News and Review. President Sandoval mentioned if he could hold a job, I wouldn't make those mistakes. But anyway, President Sandoval mentioned that it was going to be updated daily. I noticed on the dashboard it said weekly. Is that?
So we've, up to now, we've had a daily kind of count of cases that are on campus. And I think that that's been a bit confusing because, again, some of those reports come in a day or two or three later. So we felt that a weekly update really gives you more of a snapshot of what's actually happening throughout the week.
So the numbers won't change until the end of the week?
Correct.
Also, I do follow up. You mentioned 4% of the classes are in person, 23% some in-person component. Are there any numbers that are attached to that, a head count that would be attached to that?
You know, what I can tell you is that there's totally a little over 4,000, I think about 4,500 that have some in-person component out of a total of over, you know, about 21,000. So the density on our campus on a day-to-day basis is much different. You know, it is, you know, we've looked at day-to-day for the classes that students have. Less than 1,000 students are apt to be on campus at any one time.
Oh, thank you.
Hi, this is Lucia Starbuck from KUNR Public Radio, and I have a question about the dashboard. For some of the parts where it says as of 10/2, when is the start date for that? Like for where it says like cumulative student, faculty, and staff testing results as of 10/2, when did those start? Sorry.
That's a good question. So the cumulative data goes back all the way to March. Obviously, there was not a lot of testing done really until July, when we first brought students back to campus for the second session of summer classes. So the majority of that is going to be from July on. However, there are some numbers that go back all the way to March.
Okay, thank you. And then I have another question too. Do you know why on the dashboard it says there's been 581 cases, but I'm also on the NSHE website and it says that they're just having different numbers. It says 590 students, and then on the NSHE website it says 36 staff, but it says 42 staff on the UNR dashboard. Do you know why those numbers are different?
So the NSHE data is reported a little bit differently, and the those data, and again, this is where the dashboard is important in understanding that numbers can get a little bit different on different sites. So those are numbers on the date that have been reported to UNR for cumulatively for that week. But it ends at 3 o'clock on Friday. So that data might look just a little bit different from the numbers. And that's where I think the weekly data is important so that you get an ongoing perspective, because the number from one date to the next might look a little bit different.
Thank you.
Doctor, can you hear me? This is Ed Pierce at KWLO. Can you hear me?
I can hear you, Ed.
Okay. Well, you've closed down the Wigan Center. Obviously, that was a hot spot. I'm wondering what role you think is being played and whether you're able to trace this of off-campus meetings, parties, and what have you. How big a problem is that?
I think clearly that you raised a really good point. I think the strategies and the protocols that have been put in place on campus have been really important. And I do think that most case numbers, from contacting these individuals, a lot of the contacts are happening on off-campus sites, off-campus housing, off-campus gatherings. And it's a lot easier for us to put protocols and policies in place on our campus. It is much more difficult to control the off-campus behaviors.
And Governor, you've limited the attendance at the football games, closed the Wigan Center, but you can't do anything directly about these off-campus gatherings. What are you doing to get the word out and make that impression on your students that it's a bad idea?
Well, thank you, Ed. And we did it yesterday. We put out a statement to the university community, to the students. We've encouraged them to use the app that I talked about, the COVID Trace app. I've actually had a meeting with the ASUN president this morning, and I'll be meeting with the ASUN Faculty Senate this evening at 5:30. So we've been using social media. I'm meeting directly with the students to try to get the message across. And as I made it clear to them, and is that, closing the Wigan Center was not a decision we took lightly, because we know how much we value it. It was not a punishment in any sense of the word. It was because it is indeed a hot spot on campus, and having learned that there were several students that had visited there, and whether unknowingly likely that they were positive, that they were there. And so these are all decisions that we have discussed at length, and I've spoken obviously with Dr. Hug English, and we'll continue to convey the importance of ensuring that they're practicing good habits both on campus, but most importantly off campus as well. And I think everyone's starting to understand that that's where most of the issues are coming from.
Okay, thank you.
You're welcome.
Hey there, this is Brian Hoffman from 2 News. First off, congratulations, Mr. Sandoval. Good to see you again. I did have a quick question when it comes to the jurisdiction of a university, when it comes to these private parties. Do we have any type of jurisdiction when it comes to sororities and fraternities that are holding these parties? Are you guys able to step in and help mitigate that? And then also, if numbers continue to increase, do we have any plans of restricting anything further like we did with the Washoe Center?
Well, in terms of your first question and the jurisdiction, we have no jurisdiction over anything that is going on off campus. That's always something that's very difficult with the private housing and the off campus housing. With regard to the sororities and the fraternities, obviously that if they are an affiliated organization with the campus, we do have measures that we can take. My understanding, and I'll have to double check on that, is that the sororities and fraternities have not been a great source of the issue of what is going on campus, but I'll explore that some more. But yes, we do have the ability to address that with those groups. And then finally, with regard to your last question, I mean, this is something that goes on a day-by-day basis. I'll consult with Dr. Hug English. We'll consult with the Washoe County Health District in terms of what's going on, but it's our hope that the numbers are improving, as Dr. Hug English said, and that we'll continue on that trajectory so that we can continue to preserve the limited course offerings that we have, that 4% and 23% statistic that was talked about before. But certainly it's a great priority for us to protect the educational mission on campus, but that obviously goes hand in hand with the wearing masks and social distancing and doing the proper protocols with regard to cleanliness.
Thank you. And then moving on with that, when it comes to the amount of cases that we're seeing, if this does continue, is there any type of plan to move more classes to just online, or are we going to try to stick around that 4%?
Well, it's, as I said, it all depends on what happens. We do have plans in place for whatever outcome. If it were to become more serious, we would have the ability to go exclusively online. Of course, that would be a decision in consultation with the faculty as well as the deans, because that's a very serious consideration. But we're hopeful that the numbers will continue to improve.
Thank you. And then last question for Dr. English. I was taking a look at the dashboard, and unlike with the Washoe County dashboard or the Nevada State dashboard, there isn't any section for deaths. Have we had any students or faculty pass away from the virus yet?
We have not.
Good to hear. Thank you so much. Thank you.
Hi. Sorry. Can you hear me? I have a question for Dr. Hug English, Shaditi from This Is Reno. My question is about the positivity rate. I think UNR is reporting 6 point something, and the county is reporting over 8%.
Yes, this is it's a good question, and thank you for that. I think, again, understanding that week's data is simply that, it's 1 week's data with a positivity rate that was lower, but again, we tested a lower number of students that week. So it all needs to be taken in context. And again, the positivity rate does show often, as the health district has been good at reminding us, that there is a little bit of a lag time about positivity rates versus cases that are ongoing. So I think this week was a good week, but I think we need to be careful not to make too much of the fact that we saw a lower percentage. Overall, our positivity rate for September was 15%.
And Cheryl, this is Brian. I'm sorry to interrupt, but could you walk us through the Walgreens, the off-campus testing issue as well? Yeah.
Thank you, President Sandoval. Yes, this is one of the things that's become difficult for us as well as for the Washoe County Health District. There are more and more community sites that are available for testing, and that's terrific. One of those is Walgreens, and they do offer same-day testing, so that's become very popular, particularly with our student population. But because they've contracted with a private lab to do that testing, there's often a delay from when that report gets to the health district, and then even further delay until that report reaches us. And so again, where the student will find out, or the person tested will find out that day that they're positive, unless they go on our website, which we encourage all of them to do, and fill out a COVID report form, we may not find out about that positive result for over a week. So that's become a little bit of a problem. It also is a little bit of an issue, and why I say, our data, cumulative data from other testing sites may be altered as we get those tests that may have been from a week ago.
Hey, Brian Hoffman again with 2 News. To follow up on that, this might be getting a little bit too into the weeds, or it might be something that I should ask Kevin Dick about, but do we have a positivity rate when it comes to overall student and faculty? I know we do for the student health center testing, but overall testing for UNR staff and students through other testing means as well?
I will answer that. From our perspective, we don't have access to that data because we don't have the denominator of all of the other testing sites. We get the ones that are reported to us as positive, but we're not getting the number that have actually tested from all those other sites. So it'd be really difficult for us to create a positivity rate from those that have tested elsewhere.
Thank you, Doctor.
All right, we're moving along here. It's almost noon. If we could, why don't we go to Kevin Dick and let him give his introductory comments. And if President Sandoval and Dr. Hug English could hang around for the Q&A, we'll go back to them if you guys have further questions for them. So Kevin, if you're ready, please go ahead.
Sure. Thanks, Scott. And thanks everybody for joining us on the briefing today. Particularly, I want to thank President Sandoval and Dr. Cheryl Hug English. And congratulations to President Sandoval. I appreciate that he's already jumped right into his new role and support the difficult decisions he's had to make based on what we've seen with the COVID cases that are occurring in the student and faculty community in order to try to stem the spread of the disease on campus, as well as the Protect the Pack initiative and the messaging for how students need to be involved with their off-campus activities as well. And this is important because we're seeing 25% of our cases that are coming out of the 20 to 29-year-old age range. Just looked at the data for the last week. 22% of our cases were coming out of the 18 to 24 range. And I think it's really important to understand that while some of these younger people are typically not affected as severely by COVID-19, that they're all part of our community. And we need to recognize that we have other more vulnerable portions of our population. These are individuals that are faculty and staff at UNR. There are individuals that are in students' households, individuals that the younger population may be interacting with as they're out about in commerce or recreation. And so it's important that everybody do their part so that we don't have that elevated disease transmission that we have occurring right now. As of the 5th of this month, that marked the 7th month since we had our first case of COVID-19 in Washoe County on March 5th. And we've now surpassed the 10,000 case threshold in just that 7-month period. So we need to recognize this is serious and significant. Sadly and tragically, we've lost 165 of our residents during that time period. And so I think we need to continue to be vigilant and take appropriate actions to suppress the spread of the disease. I've been in the news recently regarding a letter that was made public that the health districts sent to the governor's office. I think it's unfortunate that the letter was made public, particularly before the governor has had a chance to respond to the concerns that we raised and to be able to meet and discuss those. I'm pleased that the governor has responded and we do have a meeting scheduled for this afternoon. I'm confident that we can talk through the issues and resolve them and be on a good path moving forward. So I'm going to limit my comments on that because of the meeting that's coming up. But I do appreciate that the governor's being responsive and we're having those conversations. So with that, I'll open it up to questions.
And if you have a question and can't use your audio, you're having an audio issue, feel free to put it in the chat, and we'll say it during this call.
Hey, Kevin, this is Paul Nelson with 2 News. How important is it that you do have that communication and cooperation at the state level for the decisions that you guys make?
Well, I think it's important that we have it both for our decision making as well as the decision making that are made at the state level. So I'm sure we'll be able to address that. I think there may have been some assumptions that were occurring regarding how communications were happening. So I welcome the opportunity to discuss and sort out those issues.
And as you guys get more responsibilities regarding some of the things that have happened at the state level, what kind of extra resources would help you guys to do your jobs better?
Well, the health district is throughout this response expanded at a rapid pace. And so we're more than half again the size that we were as a health district when we started out. And it's just challenging bringing on additional staff, building out additional space, even getting the phone and computer equipment to support the additional staffing. And so we're working to resolve that, but resources are certainly an issue. And we'll also be discussing that with the governor's office today.
Any other questions for any of our guests?
Yes, a question for Dr. Hug English. In light of the CDC's recommendation or report on aerosol transmission of the virus, are there any other or further precautions in classrooms, particularly with distancing, airflow, or time spent in the classrooms?
I think that's an excellent question. I think that all of the things that you mentioned that we're already doing with the social distancing and facial coverings are really important. In addition, there's been a change and increased airflow, bringing in more outside air from all of our buildings. Our facilities folks have worked very hard in trying to make sure that we're getting a increase of outside air to increase that airflow. It's interesting data. I think that certainly, the predominant method is still felt to be the respiratory droplets, but certainly those aerosol transmission is certainly part of it. Again, the distance that we have in our classrooms are really, I think, still promoting and helping to mitigate, even if there is some aerosol spread. We've really distanced those. And again, not just 6 feet between seats, but 6 feet circumference, so that there's really a lot of distance in between students.
And in terms of time spent, would you know what the average length of classes are across campus for in-person?
That varies. Some of them are 45 to 50 minutes. We've actually decreased or some of the classes decreased it down to allow more time for people to enter and exit buildings so that they are not crowding around certain areas. But some classes are longer. A lot of those longer classes, the 2 or 3 hour classes, many of them are done remotely. But there certainly are classes that are in person, whether it's a laboratory or certain in-person classes that are longer than an hour. Again, going back to that social distancing and wearing a facial covering is incredibly important in those instances. I think it's something we need to continue to watch. I think it's interesting data that's come forward. But again, I think the predominant spread remains those respiratory droplets.
Hey, Brian Hoffman with 2 News again. Is there a number that some type of goal that we're aiming towards to bring back either in-person games, the public being able to go to games, or reopen that center that was just closed down? Or are we kind of just in a holding pattern for now, and we'll see day by day?
I would say that we are continuing to watch the data, and we've said this from the beginning, that really the data is driving decisions, right? We need to know that our numbers are an important factor in the decisions we make going forward. So I think that is something we'll continue to watch as far as making more decisions going forward about games, and whether lessening restrictions or tightening further restrictions. It's going to be data driven.
Any other questions for our guests? Okay, then we'll wrap it up. I just want to let everybody know this meeting was being recorded, and we'll have it on the COVID19washoe.com website here shortly. I understand there were some technical issues where some people weren't allowed to get in. I got three or four emails about that. So if you do hear any of that feedback, please feel free to direct people to me or the COVID19washoe.com website. There's a tab under press where you can hit press conferences and watch all of our media briefings that we've had throughout the course of this pandemic. Thanks again to Dr. Cheryl Hug English and President Sandoval for joining us, and have a great week. Thank you.